Hey friends, welcome back to the Parenthood and Relationship Podcast. Today's episode is one that I've been really excited to share with you. I'm joined by Lynn, a pelvic health physical therapist who sheds light on something so many of us never get taught: what really happens to the body after birth, how it affects our relationships, and why some postpartum issues linger for years if left unaddressed. If you want to take this conversation a step deeper, I've created a special journaling prompt for you so that you can reflect on your own experience, emotionally, physically, and relationally. You can get it by joining my newsletter at markelikaplani.com/newsletter. You'll find the link in the show notes as well. Let's get into it. Hi there. If this is your first time here, welcome to the Parenthood and Relationship Podcast. I'm your host, Markela Kaplani, a psychologist, a parenthood and relationship coach, and a parent myself. Together, we explore the transformative journey of parenthood and its profound impact on our relationship with ourselves, our partners, and our children, so that we can be present and show up as we envision without having to do more. Let's get into today's episode. So, hi, Lynn. Thank you for coming onto the Parenthood and Relationship Podcast.
Thank you so much for having me. I so appreciate any opportunity I can get to share what I know, because I think what I do know can really help couples, especially after having a baby. So it's so important for moms to know what's happening in their body and why things might be feeling the way they are, and for partners to understand it all. So thank you for letting me be here.
Thank you. Thank you for coming on. I think it's really important what you have to tell us today. So, I want you to start with an introduction about who you
Okay.
are and what it is that you do and how you help.
Great. So I'm a pelvic health physical therapist. I've been one for over 30 years. And I discovered more than a decade ago that the bones of the pelvis need to widen. I mean, I didn't discover this. This is the mechanics of childbirth, is that the bones need to open and they need to move in different positions in order for a baby to come on out. And there's just this general assumption in the medical society that everything goes back together again right after birth. And I discovered that they don't, and that the bones of the pelvis can remain in what I'm coining an open birthing pattern after birth. So, what needs to happen is your sit bones, those two bones that you're sitting on right now, they need to splay apart for a baby to come on out. Your tailbone, your sacrum needs to lift backwards to widen the pelvic outlet for a baby to come on out. And we all just assume that the bones go back together again because there is somewhat of a recoil that happens in our bodies. But what can cause problems is when the baby either comes through in a crooked fashion, so we call that asynclitic, or the baby comes through occiput posterior, or OP, or sunny side up, or it's just a really big baby. Those can stretch our pelvic joints beyond their ability to recoil back to their original position. And what I discovered is that these bones are like still trying to get the baby on out, that they're stuck in this open birthing pattern. And then knowing the mechanics of what needs to happen, and then understanding what happens when we get into these different positions, I started noticing, oh, wow, the bones are affected by the position we're in when that baby comes out. And so, if you're working with a pelvic health PT and they're not asking you what position you were in when your baby came out, they're missing a big piece of the puzzle, especially if they're not addressing the pelvic bones after birth. And so, what we need to understand is that the pelvic bones need to widen for baby to come on out, but all of our pelvic floor muscles are attached to those bones that are being stretched open. And so it's like the pelvic floor muscles become a tightrope
Mhm.
and they become stretched. And that stretch on those tissues doesn't allow those tissues to function as well as they should be able to. And so, some of the issues that can happen because your bones are in this open birthing pattern is you could have back pain, you could have pelvic pain, you could have pelvic floor muscle weakness, you could have insertional pain with intercourse, because these muscles are being stretched open and they don't have the ability to stretch more. So I had a client that came to see me and she was only 3 months postpartum. And she came because her doctor said, oh, she tore and that she had to have scar or she had scar tissue in there that was causing the problem. She was having pain with intercourse, insertional pain. And when I went to evaluate her, she delivered at home and she tore, so the midwife stitched her up. And then she developed this pain with intercourse. And so she went to her OB, and her OB's like, oh, you have scar tissue in there. Well, actually, when I went to evaluate her, the vaginal opening is meant to be like a circle. It should be round. And if anything, it's maybe a little bit oval from top to bottom. But when I evaluated this client, her opening was like an oval wide side to side. Like it wasn't a round circle, it was like a
Mm.
slit.
Was this
And
because of the stitching?
no, no, because there was no, I couldn't feel any scar tissue because her, instead of being, a round circle, her opening was flat side to side instead of being like this round circle. And so I knew from that her sit bones that those muscles attached to were pulling them too far apart. So I just brought the bones back together again, and she immediately had a circle. And then her scar tissue popped in, and it was just a little bit of scar tissue. So that really wasn't what was causing the problem. It was that her muscles were being pulled open and pulled apart from the birth itself. And that was causing the pain with intercourse. And so, because I know how to address the bones after birth and address the pelvic floor muscles together, I can get a lot of people who are having pain with intercourse out of pain in one session. I can get people with back pain out of pain in one session, in pelvic pain, so it's just they're understanding and recognizing that, hey, these bones, they don't always go back together to their original position after birth. And so that's one thing that I want everybody listening into this to understand. And some moms will come to me and go, yeah, I feel like I sit funny now. And that could be that their one sit bone was more out to the side than the other. So if you labored on one side, the side you're laying on, that side can't move. So your top part of your pelvis has to move more for your baby to come on out. And so that's going to cause this imbalance in the pelvis that could cause hip pain on that side. It could cause, the back pain, the pelvic pain, and cause you to just feel like, I don't feel like I sit evenly anymore. And then the tailbone that has to lift backwards for baby to come on out, sometimes that can get really stuck. And then moms complain about not being able to lay on a hard surface on their back, that it really hurts when they lay on their back. And that's because their tailbone is pushing too hard into the floor because their sacrum is stuck in that position. So these are things that I just want women to understand about their bodies after birth and to know that there is help. I'm working tirelessly to try to get the word out about this work and teach more practitioners to help them to know how to address the bones after birth. And the clients, my students, are getting great results with their clients after learning what I have to teach them. So I'm super excited to be spreading this work, and I appreciate this opportunity to share this with you and your audience so that we can just help moms to know, one, you're not crazy, and two, that there definitely is something going on in your body after birth. So, one of the things that I found working with all these 20 old, late 20-year-olds who have just had babies, first time mamas, right, coming into my practice. And then I flew home and I was working on my aunt who was in her 60s. She had a 47-year-old son at the time when I saw her. And I'm like, your pelvis is doing what all my young new moms is doing. And she's like, yeah, she had a horrifically traumatic first birth. And her son was 42 at this time. And I was like, oh my gosh, this can last in our body for our lifetime?
If
And it can
unaddressed. Okay. Wow.
if it's not addressed.
One of the questions that I have for you is let's assume that a mama didn't know about this. And so I'm really glad that you opened up bringing awareness to this topic because there are a lot of topics, including this one, obviously, that we are not informed about. We don't know. We assume, and there isn't enough
Yeah.
information out there. And so we just think that everything goes back to normal, that this is something that we should just power through. So it's really, really significant that you're saying this, that we're normalizing it. But I'm wondering for moms that may be listening, because my audience is not just new moms,
Mhm.
and for partners who are listening and maybe thinking, oh, my wife does complain about these kinds of issues, but it's been a while that she's had babies, that we've had our children.
Yeah.
And so the moms who are listening and are saying, oh gosh, have I lost the opportunity to be able to resolve this? I want you to give us your take through your work and
Yeah.
experience. What happens then?
Yeah, it's never too late to heal. It's never too late to heal. It just may take a little bit longer because it's been being held in your body longer. So if we can get new moms less than a year from post-birth, their tissues don't remember that position as often. But when you take a mom who's had this in their body 10, 20, 30 years, we can still make effective change. It's just the tissues are going to be, but wait, isn't this where I should be? And we need to just kind of remind it. So it sometimes just takes just a little bit longer for the body to let go and to release and to find that new sense of normal. Because, unfortunately, after a baby comes out, there is no sense in your body that your body doesn't remember normal. Like it is just opened up to let this baby on out, and your body's like, whoa, what just happened to me? And if that remains that way for 20, 30 years, your body now thinks that's normal. So as we start making these changes and try to bring the bones back to their original position, their body may be going, but wait. And so it just needs more repetition, more time. But then the other thing that's really important, and this really gets into the relationship factor, is that a lot of births are traumatic.
Mhm.
And so part of what can hold those bones in that open pattern is the trauma response in the body. And so the trauma response in the body is we can fight things, flight things, or we freeze. Well, in birth, you can't fight birth. It's happening to you. And then you can't flight from it. You can't run away. You got to get that baby out somehow. And so the main response in our body is the freeze response. And so our pelvic bones go into that and they're stuck being held open in that freeze response. And I tune into it. I really know how to listen to the body and to the tissues, and I can sense when the pelvic space is like holding its breath, and there's that freeze response in there, and we need to address that, and then we can get in and help the tissues to recognize and recover to their original position so that things can function better. And men listening to this too, you can have secondary trauma just witnessing your wife's birth. And
Mm.
so I want everybody to understand. And I really don't feel like medicine these days, we're getting better, but just slightly. We're not truly understanding the impact that trauma has in our nervous system and in our ability to relate. And I have to recognize that there's small t trauma and there's capital T trauma. So there's a spectrum of trauma when it comes to the experience of it. And it does not matter what the entire room thinks of the birth. It's the perception of the birthing person, whether it's traumatic or not. So the entire room can think it was the most beautiful birth, and the person can be traumatized. Or the entire room would think that that's the most traumatic thing they've ever experienced, and the birthing person can be totally normal and not
Mhm.
traumatized. And so it's all in every single person's own perception. And so the men listening into this, I just want you to acknowledge and recognize that you could have a trauma response from watching. It's hard to watch someone that you love in pain and struggling, and there's nothing you can do about it. That's traumatic. When we have that trauma response, we disassociate, especially women giving birth. We disassociate from our body, from our pelvic space. And so I work a lot with trauma in the body. And one of the first things that I do, because I do intravaginal work, I work inside the vagina with the pelvic floor muscles. And I just use a gloved finger. I don't use a speculum or anything. And my goal is to help those muscles to be able to function well and strong and automatically. So our pelvic floor muscles are meant to be able to turn on, turn off, just like we turn on and on a light switch. But a lot of times after birth, when there's trauma, when there's disruption from tearing or episiotomies, that there's a lot of things that can cause the pelvic floor muscles not to be able to function well after birth. And trauma is one of those pieces to it. And so that disconnect, the first thing that I want to do when I'm working with my clients is to make sure they're fully connected in their body so that we can help them work with that space. I don't feel that working in the pelvic space when someone's not connected to it is a good thing. I may be traumatizing them more. And so
Mm.
the pelvic space is the area of our body that women tend to completely disassociate from when we've had things that have happened to us. Abuse is one of the biggest issues, and it can even be emotional abuse or verbal abuse can cause us to disconnect from our pelvic space. For men and women, that pelvic space is our home. It's where we're meant to live from. The analogy that I liken to what's happening energetically from this space is that our pelvis is our home. Our vaginal opening at the bottom is the front door. And when we've had a traumatic event, it's like going to the front door and opening it, and there's a scary monster at the door. And so what do we do? But we leave the door open and we turn away and we run away.
Right.
And that's energetically what we've done in our bodies is that we've abandoned that connection to our pelvic space. And so my goal in working with women is one, to make sure they're connected. And there's a great way that you can just do a visualization yourself and see how connected you are in your body. And so you can just visualize a color starting at the top of your head and just kind of flowing down your body. And you can choose whatever color you like. And then just see if you can sense that color just kind of floating down, melting down into your body. And can it get all the way down into your pelvic space? Can it go all the way down to your toes? Or does it get cut off somewhere? Does it stop somewhere? And if there's a stop in there, then that's a disconnect. That's an energetic wall that you have developed in your body to protect yourself. Our
Right.
body's always just trying to protect ourselves.
I read in your profile that you work on the physical, the energetic, and the spiritual. And I think it's one of the things that I found most intriguing because I believe that in order to address anything, we need to have a holistic point of view. And I love the insight that you are sharing with us and the practical exercise, because it is true that we can't just separate things and say, okay,
Right.
well, this is the body. I just work with the body. But the
Yeah.
reason why something manifests in the body is very much psychological most of the time, if not all the time. And it could go the other way around. The physical issue in my body that has been prolonged can cause the psychological trauma, or it's the
Yeah.
psychological trauma that I could have experienced through the birth and the physical trauma that has then ended up manifesting in the body and the way that my pelvic floor is. And so I wonder on an emotional level and the relationship level, what this can do, because you also spoke to the men and said that you could be experiencing trauma, and that's something even less talked about.
Right.
And there's also, I am thinking, the men who will be one of the people in the room, like you said, who don't recognize the trauma response that their wife, that their partner may be experiencing, and how important it is for them to acknowledge it and to validate it for
Right.
the birthing parent to be also able to let go of the trauma and how this affects the relationship.
There's so many different responses to trauma, and everybody responds differently. But let's first talk about like what are some of the signs that we're traumatized?
Hmm.
Tearing up about your birth experience, or if you talk about it, you get emotional, or you avoid talking about it, or you avoid a certain part of your body. So women who've experienced C-sections, cesarean births, they don't like touching their scar. They get emotional thinking about their birth. They zone out, they can ruminate over the experience. They'll go back to a certain point and kind of get stuck there, just not being able to take care of yourself, not being able to connect to your baby, to your partner. There's a lot of different signs and symptoms that one has been traumatized.
How does this affect the relationship if it's
Oh, thank you.
unaddressed? And if we have two partners who are potentially feeling trauma on both ends, both are feeling potentially shameful about the fact that they are experiencing trauma because this is supposed to be such a
Right.
joyous moment. And how does
Yes.
this affect the relationship?
Yeah. Well, if you're disconnected from yourself and you're in that trauma state, you can't connect to someone else. So, for a partner who's not traumatized, you're going to be feeling like you're grasping at someone who's not fully there and fully
Mhm.
present. A lot of times what you have experienced in that birth process is discarded. Like, oh, well, you have a healthy baby. So you just focus on the baby. It gets disregarded what you just experienced and what you went through. And so, one of the things that I want to share with people is that trauma can manifest in so many ways and it can manifest as pain in our body. I had one client that came to see me. She had a C-section, and for 5 years, she's been in chronic pain in the C-section site, where they've gone in 2 more times and done exploratory surgery to see if they messed something up. Well, again, medical society doesn't truly understand about the trauma impact. And she came to see me and we worked on the trauma and released the trauma from that experience. And her pain went away in one session. And she was like, I had 2 more surgeries, and really all I had to do was process my trauma. And so I share that in hopes that those listening in who have experienced trauma will know that it's super important that you work with someone who knows how to deal with trauma. I think the biggest sign is that you just don't feel like you're connecting anymore. You just feel like you're missing each other and not able to fully connect. And so if that's the case, I really encourage you to go find someone who specializes in trauma, then because it's different than talk therapy. Okay, just doing
Mm.
cognitive behavioral therapy isn't enough for a trauma response in the body. Peter Levine is kind of the godfather of trauma work, and he's written a ton of books. And he says one of the worst things we can do is tell a story from start to finish again, because it can re-traumatize us. And so when I'm
Yes.
working with my clients, I never want to have them tell me their entire birth story from start to finish. What I do is I ask them what stands out the most for you in your birth. However, I do want to say that I had a client that came to see me and she told me her birth was actually okay, but it was everything that happened afterwards was just trauma after trauma after trauma after trauma. And I'm listening to this story going, oh my gosh, what am I going to find in your body? Because there's a great book out there called The Body Keeps the Score
Mhm.
that talks about the trauma response and how it gets held in our tissues. I was listening to her story going, what am I going to do about all this? Is a lot, right? And I listened to her body. I didn't find any trauma stuck in her body.
Okay,
And
how
what
do you
I
explain
found was,
that?
well, after what I found was like before the birth. The only thing I found was before the birth. And I'm like, what did you do? And she said, I replayed the birth with my husband and my doula 3 times, going through what I felt in each moment. So that's a different process than just telling your story from start to finish. Because what happens when we're traumatized is we disconnect. The feeling is overwhelming to our system. And so that feeling being overwhelming, we disconnect from it. It's too much. We don't deal with it. And that's what gets stuck in our body. And so by her going back and reprocessing and going, oh, wait, now when that happened, I was starting to feel this. And you sense it in your body, that can help your body reprocess it so that it
Mm.
can heal it and move forward. So, what's happening to us when we're traumatized is our body, our physicality, and our mental, emotional, everything is living this timeline of our life from birth to death. And as we have these significant events that happen to us, it's like a part of us gets stuck in that moment in time. And yet the rest of us continues on. And if we don't go back and heal and work with that part of us stuck from that trauma response, then that part of us can't come into present day awareness. And that's our goal, is to bring all of us to this present day so we don't get triggered by what's unhealed, unprocessed in us. And so if you notice that your partner's more reactive and more, some of that could just be because they're exhausted because you have no sleep when you have a newborn in your house. And so there's hormonal changes, there's sleep deprivation, and there's trauma responses. And it's a big pot of soup, and you got to try to figure out, okay, what are we dealing with here? I think a lot of postpartum depression could be from these unprocessed and traumatized situations from the birth that just haven't been fully addressed yet. So I think recognizing, like, whoa, was I traumatized? Because it's amazing. Our body is so resilient. And you have this tiny little human being that is completely dependent on its survival, you helping it to survive, that your focus goes all there. There's a lot going on, and trying to tease it all out. I just want people to understand the physicality of it and the trauma response that could be happening. I work with moms. I can work with the moms anywhere. We can do a Zoom call and we can help replay and process that birth trauma and clear it from your body so that you aren't as reactive from the birth. But I would highly encourage anybody listening into this thinking, yeah, I think I might have had some trauma from my birth, to please go get support and work with someone who has that trauma training so that you can heal that, so that you can come together and have a greater connection with your partner.
Mm. I am thinking that there may be resistance before someone ever comes to you. And so there may be a lot of people who will benefit from coming to you just to even explore whether there is trauma and whether there is any tension in the pelvic floor area that needs to be addressed. But in my work, I see that a lot of times there's resistance in even accepting that there may be postpartum depression, postpartum anxiety, that there may be trauma, that there may be overwhelm and psychological exhaustion. And so there's a lot of shame in that. And I wonder, what do you do to address that so that you can help people come to you and come to the people that you have trained for this purpose?
Right. The first thing I love to do is just honor and acknowledge what is.
Mm.
We try to put on this perfect facade. Social media has done us such an injustice in our life because we see all these picture perfect lives, but it's hard. Childbirth is hard. Childbirth is strenuous on the body. Raising and trying to figure out how to take care of a baby that comes with zero instruction manual and you're sleep deprived. It is freaking challenging. So, honoring a person where they're at and just acknowledging, yeah, I'm tired. Yes, I'm stressed out. Yes, I may be depressed. Helping them to just acknowledge where they are is the first step. We have to acknowledge it before we can do anything to change it. I think just letting people know that it's okay not to be okay.
And this is why you're on this podcast. You're spreading the word. This is
Yeah,
the first step. Mm.
it's okay not to be okay. And to acknowledge that is the first step to be able to make change. And so I just want to normalize the not okayness.
Yes.
And I think if we can just honor women where they're at, what I notice in my work, we want to kind of brush things off and, oh, you'll be okay. Oh, you're okay. We do this to our kids all the time. Oh, you're fine, honey. You're fine. You're fine. No,
Right.
they're
The
not.
toxic
They're crying.
positivity that basically just dismisses feelings altogether.
Yes, yes. And so, the first thing I do is like, yeah, that was overwhelming for your system. That was overwhelming to your body. And I think as I just acknowledge that back to the people that I talk to, they're just like, wow, I feel seen. I feel heard. And I think that
Validated.
makes, yeah, I think that makes them feel more comfortable in coming in. And I also want moms to know they're not alone. They're not the only ones feeling this way, that it's very common. but it's not normal. And that's the biggest myth. As pelvic health physical therapists, we deal with stress incontinence all the time. Stress incontinence is extremely common after birth, and doctors just make you feel like it's normal, but it's not.
Explain a little bit what that is for people that
Yeah.
don't know.
Sure. Stress incontinence is when you leak urine, when you laugh, cough, and sneeze or exercise, or there can be frequency or urgency where you can't get to the toilet on time. You leak urine before you get to the toilet and sit down to pee. And so that incontinence, that leaking of urine when you don't want to be, is a very common issue that happens to women after childbirth. And no matter how the baby comes on out, I think it's just a side effect of pregnancy. And there's a couple of things that are going on there. And one is that the way that our belly gets stretched out during pregnancy, the lower part of the belly gets more stretched out than the upper part of the belly. So the belly part by your ribs are stronger than the lower part after the baby comes out. And if we don't know how to effectively strengthen the entire belly in a way that helps to keep the stresses off our bladder, we can develop habits and patterns where the upper part of our belly is contracting more than the lower part. Because the lower part, because it gets more stretched out, it gets more lazy and it needs more effort to get it to turn back on again. And so you really need to engage that lower part of your belly at more so than the upper part of your belly so that you can avoid that stress incontinence. Because when you go to laugh, cough, and sneeze, if you're squeezing really hard up by your rib cage, that pressure is going down and it's hitting your bladder and causing you to leak. If you put your hands on your lower belly and you just cough, does your lower belly come in or does it go out? That's our cough test that we do. And if your belly goes out, that's telling you that your upper part of your abdomen is working more than the lower part.
Hmm.
And so you need to work to help get that lower part to kick in more to keep the stresses away from your bladder so that you could stop leaking.
And when you
And that,
say work more, do you prescribe some kind of exercise for women to follow?
yeah, just a matter of putting one hand on the upper part of your belly and the other hand on the lower part of your belly. And as you draw your belly back, your lower part should be working just as hard, if not harder, than the upper hand. Okay. So when you go to work, because the upper parts didn't get as stretched out, it's stronger. So it's easier for it to draw backwards than the lower part. And so you need to work and get that lower part working more so that you can get the entire structure working together as a unit instead of the upper part pressing and that lower part pushing out.
So, am I
Okay.
to assume that this would be a special kind of exercise so that while you're exercising in a typical way, you might be working both parts the same, and so you're making the upper part
Yeah,
even stronger and still the imbalance remains?
exactly. So if
Okay.
if you like do crunches and every time you crunch, your lower belly pushes outward, you're making that upper part stronger and you're
Mm.
not changing the dynamic between the two. And so you really need to engage that lower belly more. It's all one sheet of muscle, like there's layers, different layers. But because that lower part just gets more stretched out with the baby because it sits lower, it just gets weaker. And so it needs a little extra attention to it to make sure that you engage it and bring it back in with everything you do. So if you're lifting weights on the exertion, you really want to make sure that that lower belly is coming back up. There's one gal that talks about an up arrow. So, and that's why it's so important for your pelvic floor muscles to kick back in because your pelvic floor muscles are connected to that lower part of your belly. And so if you can start with a pelvic floor muscle contraction, that should bring your lower belly back up and in. And so then it's like from down up, we're contracting that belly in versus top down. So the top down is going to be putting more force down versus that bottom up contraction is going to take the stress away from the bladder. So you stop peeing when you go
And
to exercise.
on a practical level, if this is left unchecked, right?
Mhm.
So I'm not just talking about the muscles, but I'm also referring to what you said about the bones being more open and out of place. I don't know how to
Yeah.
describe it the way that you're describing it, but I'm thinking if this is left unchecked and then a woman wants to get pregnant again,
Uh-huh.
is that going to be problematic in some way? Is this why a lot of women will have a difficult pregnancy the second time around and will need to stay put for several months?
Great question. Thank you so much. It's one of the great point or main points I want to get across is that if you so the biggest issue that will show up in a subsequent pregnancy if you are stuck in this open birthing pattern is pelvic pain. So I see a lot of women in pregnancy that develop pelvic pain. And if it's a subsequent pregnancy, my number one question I ask them is, did you have this pelvic pain in your first pregnancy? And if the answer is no, then I know that this pelvic pain is because their bones are still open and affected from that first birth. And when I'm able to help bring those bones back to their original position, that pelvic pain goes away a lot of times in one session. When the bones are in this more open position, your pelvis is a little more unstable. And so, what people tend to do to try to stabilize themselves is they like tuck their bottom underneath and they tuck their bottom to try to stabilize things. Well, actually, that causes the pelvic organs not to be as supported than when we're in a good position. So, when our pelvis is in a neutral position, the pubic bone in front is acting like a shelf of support to the bladder and the uterus. So, the pubic bone is more in a position like this, and the bladder sits right here, and the uterus sits right on top of it. But when we tuck under, our pubic bone becomes this angle, and now our bladder and our uterus don't have the shelf of support. It becomes a slide more. So
Mm.
tucking under to try to stabilize yourself can actually cause more problems in the long term with pelvic organ prolapse. And so some of these things, if we don't address the bone position, we don't address the pelvic floor muscles to be able to contract well, can lead to big issues when we get older. And so I
Mm.
really want women to not have to deal with anything. I want them to get their pelvic floor muscles working well. And I have to say, I am astonished every day that I am in my clinical practice and I see a new mom come in postpartum and I assess their pelvic floor muscles. And when I go to ask them to contract their pelvic floor muscles, like 20% of the fibers can actually contract. And by the time I'm done doing what I'm doing with them, we've got 80, 90%. Like the amount of change in strength in one session is incredible, incredible with my clients. And I know my students are, I don't know if they're able to get it in one session, but they are getting better results doing what I'm teaching them. And so I'm excited to get this work out into the world and train more body workers, more physical therapists, occupational therapists that are in pelvic health so that we can give mom the support. Because if you have muscles that can only contract 20% of the fibers can contract, and you're told just do Kegels, just do Kegels, well, that 20% is all that can work. We're not getting the rest of those muscles turned on. What I liken birth to is baby's coming through that pelvis. And as it comes through that pelvis, it rearranges the furniture of your pelvic organs. I find your bladder smush off to a side. I can find the cervix anywhere in there. And it needs to be in the midline. It needs to be a pinata in there for intercourse to be comfortable. So another issue with intercourse is deep thrusting pain. So we can have deep thrusting pain as well. There's insertional pain and deep thrusting pain. Deep thrusting pain is a cervical mobility issue. That cervix needs to be pinata-like in its ability to move around in there so that when the penis is coming in, it can move out of the way. If you've had a cesarean birth, that C-section scar can anchor that uterus and cervix into a position, and then you go and the penis hits it and it can't move because of the scar tissue. That's like it's hitting a brick wall, and that creates the ow, which is the deep thrusting pain. So if you've had a C-section, you need to get in there and release that C-section scar tissue. I have a video on YouTube that you can watch to learn how to do that yourself. But I would really encourage you to go in and see one of my trained therapists. I have a directory on my website. We'll put the link in the show notes so you guys
Yes.
can check to see if there's someone near you to go get support, go get help. Let them release that scar tissue so that you can then just maintain it. And you need to maintain it for the rest of your life. I just worked with someone this week who was like 10 years post C-section and 9 years. And it had gotten all tight again. She had stopped working with that C-section scar. We don't know how long scar tissue tends to form in our body, so we need to keep mobilizing it. We know that kids never put anything back to where it belongs, and the same is true of childbirth as that baby comes through. It, moves things around and it doesn't go back to its original position. And that's part of the protocol I teach to body workers who can do intravaginal work, how to get things back into place so that things can function better. And it's amazing how much just getting the bladder back into place, get the cervix mobilized and in the midline, the pelvic floor muscles just come on board so much better. I hate that some moms are taught to just like, well, just do Kegels. It's like beating your head against the wall to get rid of a headache. Only those muscle fibers that can contract are going to be able to contract until we help the rest of the tissues.
And so I have another question that came up as you were describing this, which is, could it be possible, and this is for mothers who have given birth through C-section and mothers who have given natural birth, and maybe it's a different answer for the two. Could it be possible that a mom postpartum may not necessarily have immediately experienced any pain, any discomfort, and it starts to show up and it's related to giving birth, but it shows up later and therefore it is masked as something irrelevant to the birth, but it could be the birth?
Absolutely. And that is super huge. Thank you for asking that. For C-sections, that is very, very typical. Some women, and this is a smaller minority, will have pain right away. And that could just be scar tissue in the way that the tissue is healing. But for the majority of people, the scar tissue issues from cesarean birth sometimes don't show up to 10 to 15 years down the road. And by then, nobody's thinking about the C-section scar that could be causing it. Okay.
Mm.
So there's three issues that C-section scar tissue can form. And I talked about one being the deep thrusting during intercourse. That pain can be from C-section scar tissue. But bladder frequency after C-section scar, that the scar tissue forms very haphazardly to heal the tissues in that area. And it can inhibit the bladder from being able to expand. And the bladder has stretch receptors in the wall of the bladder. And once the wall gets stretched, that sends a signal to the brain that you got to pee. Well, if the scar tissue is causing those signals to stretch, then that's sending that signal to the brain. I got to pee, but you just peed 20 minutes ago. And so getting in there and releasing that scar tissue allows that bladder to be able to expand further. Do you be able to hold more urine before you have to go to the bathroom? So that's the second issue. And then the third issue is low back pain. The C-section scar, there's always one side that's tighter than the other. It's 100%. You will find if you've had a C-section, one side will be tighter. It could be the side that the surgeon stood on. It could be the opposite side. It's the way they pull as they're suturing the tissue closed, and one side will be tighter. And so that can create this torquing of the uterus because the uterus then gets pulled and rotated, and then your body kind of rotates to protect the uterus, which pulls on your sacrum because there's a uterosacral ligament that connects the uterus to the sacrum. And so if the uterus is pulling, it's going to pull that sacrum with it, and then it can't function freely like it's supposed to, and it creates back pain. And a lot of times that back pain develops 10 to 15 years down the road. Nobody's thinking C-section scar. And they go to chiros, they go to PT, and nobody's addressing the C-section scar. I had a girlfriend who has the same age boys as I did, and they were like 8 and 10 when this first occurred, but she was getting ready to go camping and her back went out on her. And so she came to see me, and all I did was work on her C-sections. She had had 2 C-sections with her boys. So I released her C-section scar. She got off my table, didn't have back pain, was able to go camping the next day. 2 years later, She was getting to go, ready to go camping, and her back went out on her again. I really think she doesn't like camping, but
I had that same thought.
right? Her back goes out on her. She comes in to see me, but this time she had had knee surgery and ACL repair 6 months prior. So she had been hobbling around on a bad knee for 6 months. And so I adjusted her pelvis, I adjusted her low back, I worked on her knee and her leg and her hip. And I saw her the next day and she's like, no, I'm still in pain. It was at a school picnic. And I'm like, oh, I never worked on your C-section scar yesterday. So I lay her on a picnic table. I get in there and I release her C-section scar tissue. And she gets off the table. She's like, yeah, I have no pain. I'm like, okay, you need to work on your C-section scar and keep it released. Your back pain will be fine. She had been seeing chiropractors for years and nobody's addressed her C-section scar.
Okay,
So,
so it's something that needs to be happening at steady intervals, is what I'm
yes,
understanding. And I'm also
yes.
wondering what happens for women that have given natural birth. Is that a
Yeah,
common experience for women to experience later in life issues that may be related to the birth and may seem
yeah,
irrelevant?
right. So remember, we were talking about that open birthing pattern, the pelvis being slightly out of position. Our body is amazing at adapting. And so it can adapt, and you may not have any pain. Your pelvic floor may be able to function okay. But when you get pregnant again, we talked about that. That is a slightly unstable position for your bones to be in. And then you add a pregnancy on top of it, and that's what creates the pelvic pain because that pregnancy hormones makes you even more unstable, and that's what creates the pelvic pain. I would say the majority of the clients come in to see me only have about 20% of their pelvic floor muscles being able to activate well in doing a contraction. And so to me, that's not fully supporting our core and our ability to protect our pelvic organs. And if we don't do that rehab, remember we were talking about that belly jutting out forward when we go to cough. If that persists over time, now when we're 60 and 70 and 80 years old, we're then going to develop stress incontinence and potential prolapse because we need to understand our from the diaphragm to the pelvic floor is a canister. It's a canister of in your abdominal wall and your back. It's a canister of pressure. And that pressure's got to go somewhere. If your pelvic floor isn't strong enough to maintain the pressure of that cough, remember when you cough and your belly goes out, that pressure is going to its weakest link. And so if your pelvic floor is that weakest link, then that pressure is just going to keep going down. And over time, it's going to develop problems. It is my dream and goal that every person who gives birth will get an appointment with someone that I've trained because then I know that they'll get the support that they need in healing their body after birth. If we address it in the way that I teach others to do so, we get people back to their 100% function. So,
Perfect. So we
yeah,
could be talking all day about this. I think this is a
yeah,
very important topic. I'm very glad that you came on the show. And I would like, before you leave us, if you could share one essential piece of advice, the one thing that you would hope that our listeners could keep from this conversation if they were to remember just one thing.
wow. I think that the one big piece is that carrying a baby and giving birth makes a lot of changes to your body and is very challenging, not only to your body, but to your psyche, to your emotions, to everything. It can be traumatic. And so I just want people to recognize and know that I see you and what you've been through because I've seen it in my clinic. And I wish I could change a lot of our birthing practices, especially in the hospital. And I wish I could change this idea that you have to be okay after birth. I want people to know that it's okay not to be okay and to know that there is help, though. That's the key. There's always help and there's always ability to heal. Your body is amazing, it's resilient. And if you've been challenged from your childbirth, just please know that there is support out there. and that you can recover and that you don't have to just live with it. That's, I think, the message that a lot of OBs give moms. And they just feel like they have to, like, oh, okay, well, this is what it's going to be like for the rest of my life. And that's not true. That is so not true. And so I just want to honor women for what they have gone through and give them hope to let them know that healing can happen no matter how old your baby is.
Right. This resonates a lot with me. It's a message that I share a lot on this podcast, which is that just because this is natural in a sense that we
Mhm.
were made to do this, our body was made to do this. And just because millions of women have done it before us, it doesn't mean that it's supposed to be easy. And it
Yeah.
doesn't mean that it doesn't cause any issues later, that it doesn't need to be addressed, and that we should just allow it to happen as if it's part of the experience or that it's not supposed to be. But if I talk about it, it may mean that I'm the odd one out and that there's something wrong with me, that I am failing. So I love that your biggest piece of advice centers on normalizing this, validating that it is hard
Yeah.
and that it will cause some kind of an adjustment to our body at the very least, that we need to understand is okay and that there is help out there.
Yeah. And one other piece, if I can share real quickly, is that with pregnancy, it's super important for us to be moving our bodies more. I would say that if you are pregnant, you should be at least walking 2 miles, if not 5 miles a day. We're too sedentary in our lifestyle, and I think that's why we're having more problems delivering babies. Like back in the day when we were working the fields and we were squatting and bending and had to move our bodies more, I think childbirth was easier for us. So there's a lot that you can do to prepare your body to have a smoother birth. And one of the biggest things is moving your body more and getting more mobility in there and stay off your tailbone when you're sitting. So if you guys are in that pregnancy mode, you need to make sure your baby gets in the best position possible before you go into that labor, and that aches and pains should be addressed before you go into labor, because if they're not, they can impact your labor. So there's a lot that we can do to set ourselves up for a smoother birth and a faster recovery.
Thank you so much for sharing your wisdom with us and your experience. I hope that everyone has listened very carefully and that they will visit your links that I will make sure to put in the show notes, and that you keep on training more people. Do you have anybody trained here in Greece?
In Greece, ooh, that I don't know about that, Markella. I don't.
Because
You
I
know,
live in Greece and I do have listeners from Greece, so I think it would be a gift to themselves if they just went in for an assessment to see if
yeah,
there's anything at the very
yeah.
least.
Right. Well, I would have to say, so my courses are taught online. So if you are a mom and you are working with a pelvic health physical therapist, please let them know about my work and encourage them to take my online classes. And also let them know I'm going to be in the UK in July. This is 2025. Be in the UK teaching this year so they can fly up to study with me live and in person. And if we get a big enough group, I'd love to come to Greece and teach a group of
Awesome.
professionals that want to learn how to support moms better in the recovery after birth.
Thank you again for coming on. I
Awesome.
wish you all the best.
Thank you so much for having me. I so appreciate this opportunity. Thank you.
Thank you.